Morning, Ash.
Hey. How you going? Can you guys hear me? Excellent.
No problem at all. You were over at the University of Melbourne for the day?
I am.
Yeah.
Yeah.
Cool.
It's very pretty here.
It is a beautiful campus, isn't it?
Yeah.
Absolutely. Those old buildings and everything. It's lovely.
Good
They
morning.
Good morning, Ainsley. How are you?
Hi, Ainsley.
Very well. Hi, all of you.
Hello.
Good to see you.
Nice to see you also.
Is it just the four of us?
We're expecting, I think, about maybe 10 to 12 consumers from across the Monash
That's
Department,
great.
which is great. So,
Joe, how are you? I haven't seen you for a while.
Peachy.
Oh, good.
I like that word, peachy. It says
Yeah,
it
I was
all.
going to say that. I haven't heard that for yonks.
I'm flying to Noosa tonight for a
Oh,
conference
nice.
on health equity. So I'm looking forward to having
Very
a bit
good.
of warm weather.
And who's running that?
So it's a PHN, so working for
All
PHN,
right.
another job.
Excellent.
It's a PHN conference.
Very good.
Yeah, should be nice.
And
Bit of
Ange,
sun.
Ashley, you're fully recovered?
Yep. We're all good. Thank you.
All good.
I'm heading to Brisbane tonight because there's a 2-day ARA meeting, which will be good to catch up with everybody.
Oh, that'd be great.
And I
Yeah.
looked at the weather forecast. It's quite warm up there. So it's like definitely
Lovely.
lighter clothing. Absolutely. Like
Yeah.
probably about 30
Oh,
on the weekend.
well, it's a bit wintry here still.
Yeah, you look like you're quite rugged up.
Yeah, yes, it's not cold, but long sleeves.
Yeah. Hey,
Yes.
Tess, good morning. How are you?
Good morning. I'm
Morning,
feeling good.
Tess.
How are you? Good morning, Ainsley.
Good morning, Angela. It's Margaret Thomas.
Hi, Margaret. Good
And
morning. I
Margaret,
haven't seen you for...
I've got a very brand new monitor, and my son connected it for me, but apparently the camera's not working at the moment, but I can hear you.
Excellent. No, that's fine. Margaret,
Sorry
it's
about that.
not at all. It's great to hear that you've got some new equipment, and it's all
Yes.
we do rely on
Well,
those other generations to help us
yes,
through
we
kinds
do.
of things, don't we? Haven't
Well,
seen
I
you for ages.
No, but anyway, thank you for the invitation to attend.
That's a pleasure. It's lovely to have you online. Hey, Jack, good morning. Julie, good morning to you both.
morning.
Hi, Eileen. Nice to see you. And Catherine, I can see you there as well. Hi, how are you?
Good, thank you. Morning.
Great to see you all. We'll get started. I'll just hold off another couple of minutes because there's a few people just dialing in.
Yeah, it's
I'll
only
share my
just 10
screen.
now.
Just clicked on 10 o'clock. Yeah, absolutely.
Couple more coming. Yes, there. Hello. Bill.
Hi, Bill.
Hi,
Good
Bill.
morning.
Hi, everyone.
Nice to see you.
Good to see you too. I'm glad I got in easily. Too slightly.
Absolutely. Hi, Sarah. Good morning. Nice to see you.
Hello.
Hi, Alison. Good morning and to you as well.
Good morning. Hi, everybody.
We'll get started in just a minute or two, everyone. Just a couple more people we're expecting. And then we'll make a start.
Can you see my slides, Angela?
Yeah, thanks, Joe. That looks terrific. Thank you. Awesome. All right, everyone, we might make a start. A very warm welcome to you all, and thanks for making the time to join us this morning for our education seminar. When Joe and I started to plan for Monash Partners establishing some consumer advisory panels about well over a year ago to Joe now, probably almost 2 years ago, one of the things that we wanted to do was offer consumers across our network and researchers the opportunity to understand and learn about consumer and community involvement at a deeper level and in its many different forms. And so today's focus is on hearing from Julie and Jack about some of the work that they're leading and the opportunity to ask some questions. So it's terrific to have you all on here, and we'll organise also a social event before the end of the year somewhere in the southeast, which is convenient to everybody. I wanted to take a moment also to acknowledge the traditional custodians of the land on which we're meeting today. I acknowledge the Wurundjeri and Wurrung people as the traditional custodians of the land on which I'm working, and I pay my respects in a spirit of reconciliation to elders past, present and emerging, and extend that respect to any Aboriginal and Torres Strait Islander people, part of our Monash Partners consumer and community involvement and researcher network. Wherever you are, we acknowledge and pay respects to our First Peoples. So a very warm welcome to you all. As I've said, today is an opportunity to have to hear from Julie and Jack and their perspectives and stories, and to answer some questions, and just to continue to learn as a community that's really passionate about involving people with lived experience in all of our efforts to translate research into healthcare and to undertake healthcare improvement as well. So we hope you find this session useful, but we'd value your feedback at the end. This is the first time we've done a dedicated education session for our consumer community. So your feedback is always really, really useful. I might now, I think, take a moment to introduce, we've got two speakers, Jack and Julie, and then also Ashley Eng from the Monash Partners team. Ashley's a research fellow at the Monash Centre for Health Research and Implementation, and she's playing a leading role in a project that we're leading, funded through the Medical Research Future Fund, which will deliver a really exciting online digital hub, which will host resources in consumer and community involvement for consumers, researchers and clinicians, and also provide a way for people to connect through discussion forums. So Ashley's kindly joined us this morning, and after the presentations and questions, she's going to give us a brief update on where that's at. It's very exciting. It's now at a prototype stage, and I know a number of you have been involved at various stages in its development. So thanks, Joe. I might invite you to take down the slides. But perhaps before we start, we haven't got too big a group. I might just invite everybody to just go around and just to say a very quick hello and introduce themselves, starting with Ainsley.
Good morning, everyone. Ainsley Kale. I'm a consumer lead for Monash Partners, and also fulfil a number of roles for the National Health and Medical Research Council and Medical Research Future Fund. Thank you.
Ainsley, thank you. Tess, over to you.
Good morning, everyone. She, her pronouns. I'm a consumer participant, consumer advisor with Monash Health, and also associated with a few Monash University research projects. I sit on a number of steering committees and advisory groups.
Welcome, Tess. Eileen, over to you.
Everyone, my name is Eileen. I'm also a consumer representative on a number of committees in addition to this one. Yeah, so happy to be here. Thank you.
Welcome. Bill, nice to see you. Over to you.
Thank you. My name's Bill, also known as Vasilios. I'm a consumer advisor or rep for Monash Health Partners and Better Health Network, and I'm a community member on a couple of advisory groups for my local council at the City of Port Phillip.
Thanks, Bill. Sarah?
Oh, hi. Apologies. I have a respiratory infection, so lucky this is a virtual meeting today. I'm a bit of a ring-in. I live up in the Hunter Valley on Wonnarua land, but I've been consumer partner with Catherine Carmichael, who's on at least here. I have lived experience of a rare blood cancer and work with her. I'm also on the Women's Health Research Network as a consumer with their the brain's a bit slow. Workforce Development Subcommittee, sorry. Yeah, yesterday I sat on an MRFF funding panel as a consumer representative. So have been doing this for about 10 years.
Welcome, Sarah. Hope you're feeling better soon. Thanks for joining us. Alison, over to you.
Thanks, and feel a bit of a ring-in as well, but my name's Alison Beecham. I'm with the School of Rural Health at Monash University. I'm a researcher, but also with the Victorian Heart Institute. So Eliza Cobb had mentioned this, so I'm grateful to be able to join. The research that I do is mostly in co-design of health literacy interventions, especially to try and improve access to health services for for people. So I do a lot of work with consumers. So I'm really interested in just hearing about everybody's experiences and what I can learn from today. Thank you.
Welcome, Alison. Everybody's very welcome. Harpreet, over to you.
And thank you. Good morning, everyone. My name is Harpreet Singh. I am an academic at Federation University Australia, an engineer by my training. And I also do work a lot with the local communities, especially the multicultural communities, on several issues. And I look forward to learning from this session today. Thank you.
Welcome. Margaret, over to you. Just can't hear you at the moment, Margaret. I'll try again. Perhaps I'll come back to you in a moment. Catherine, over to you.
Morning, everyone. I'm a research group head at the Hudson Institute in Melbourne. My lab focuses on leukemia development mechanisms and new therapies.
Terrific. Margaret, would you like to come off mute? Not working at the moment, no problem. Margaret, if you'd like to introduce yourself in the chat, you're most welcome to do so. Jo, I'm sure everybody knows you, but
Everybody knows you,
hello.
Angela, not me. So I'm Jo. I'm the Consumer and Community Involvement Project Manager at Monash Partners, and I support the establishment and maintenance of our advisory panel, our consumer advisory panels here at Monash Partners, and I also work in health equity.
Fantastic, excellent. And I'll introduce Jack and Julie and Ashley as we go along. Thanks, Margaret. Lovely to have you on board. So it's my great pleasure now to introduce Jack Wallace. Jack is a Senior Research Fellow at the Burnett Institute. The Burnett is a Monash Partners member organisation, and I've long been really interested in the work that Burnett leads around engaging and working with consumers and particularly strongly with community. Particularly and they had a very prominent role during the pandemic in engaging with the community to seek their views about various parts of the pandemic response. And so it's my great pleasure now to introduce Jack. He leads a lot of work at the Burnett around hepatitis C and other quite stigmatised conditions. So it's Jack, welcome. It's terrific to have you here, and over to you.
I'd forgotten completely about unmuting. I was so busy working up the slide, I forgot how to unmute. Thank you, Liz, and I'm honoured to be kind of asked and a bit bewildered and a bit scared. My name's Jack Wallace, so I'm Senior Research. Oh, and Angela, please give me a couple-minute warning when I'm kind of babble for not too long. So I'm a Senior Research Officer at the Burnett Institute. My background is that I used to have hepatitis C. I used to inject drugs in the late last century. I got involved in responding to health issues as a result of HIV in the late 1980s when I was living in Sydney. And HIV was being transmitted primarily amongst gay men and also people who inject drugs. And there was a big crossover between gay men and people who inject drugs, and which I'd stopped injecting by that stage and was able to kind of do volunteer work with the AIDS Council of New South Wales, which I kind of made into a career for, I haven't yet. One of the kind of things, and I was kind of thinking, one of the overall kind of issues around Australia's response to HIV was the development of partnerships with the communities most affected. And it's kind of, and for me, that kind of morphed into the kind of consumer and community involvement, you know, as a strategic and as an embedded part of the health system. I was also responsible for establishing Hepatitis Australia, which is the peak non-government organisation representing people with hepatitis. One of the things that, and the role of that organisation was we didn't get funded to do policy advocacy, but we got funded to produce nationally consistent resources. But the government kept on asking us for our opinion on kind of issues related to hepatitis C, both prevention, treatment, and access to health services. And as a person with hepatitis C, I was actually able to provide lived experience within that kind of process, which was fantastic. And yeah, I was kind of and I absolutely loved that process, but it was also incredibly difficult as a person without. I had year 10 education. I was asked to go onto a ministerial advisory committee surrounded by clinical research experts with doctors and professors and blah, blah, blah. And here was I, a person who had hepatitis C and a year 10 education, feeling a little bit out of my depth. And there is another person who also on those committees who was there as representing people who inject drugs. And so between us, we kind of used to bolster each other to kind of like talk our truth, and to talk about issues in a way that the other people, that the professionals had no idea about, that were kind of quite, sometimes we astonished them. You know, it was kind of really, it was fantastic. So I kind of managed to, I left Hepatitis Australia after about 8 years because I got bored, and I was kind of thinking that I didn't have the spirit to be able to kind of continue the work that I was doing, and I've become an accidental academic, and managed to get my PhD a few years ago, which is kind of astonishing. But yeah, I've been employed. And I'll just acknowledge that I'm on the land of the Boon Wurrung people of the Kulin Nation, and as is the office of the Burnet Institute. The Burnet Institute is a kind of very safe place for a person with lived experience to be. We offer, you know, in terms of community engagement, we operate at kind of several different levels. One at an institution level where there is a strong kind of focus on developing strategic and sustainable partnerships with the communities that we serve. And just at a, you know, this slide is kind of talks about at an institution level, particularly with Indigenous communities, which is a strong focus over the last couple of years for Burnet. And it's kind of interesting, you know, Burnet, in terms of the social, we have a viral hepatitis elimination plan. We have worked with HIV for many, many years. And one of the things is that it is absolutely inherent that people with HIV, with people with lived experience, are involved at all levels of the organisation. This is kind of one of the more recent kind of projects that we've done, which is being funded by the Paul Ramsay Institute, and it's called Eliminate Hepatitis C Australia. Now, the process for doing this work is using co-design, and co-design's been really useful kind of process. And again, we used to call it partnerships. You know, we'd work in partnership, but it's actually a more, co-design for me is a more well thought out kind of process of doing it, of kind of representing partnerships. It's also kind of, I primarily now work in hepatitis B. Hepatitis C, we got a cure in Australia that was available, and kind of quite uniquely in Australia, it was provided through Medicare for all people with hepatitis C. Now, in other countries, it was only available for people with hepatitis C who had stopped using, who had stopped injecting, or that had a certain level of kind of cirrhosis, or, you know, there are a whole lot of limits on who was able to access hepatitis C treatment. And in Australia, I think because of the partnership response, There's been, that helped in kind of ensuring that treatment for all people with hepatitis C was made available. I primarily work in hepatitis B because Hep C, I'm over it. I've done that, been there. And I kind of want to work with hepatitis B because the needs are great and the challenges are really, they're really interesting challenges. Hepatitis B in Australia is primarily affects people who have been born overseas. So it's people, the top three kind of countries of people with hepatitis B were born in China, Vietnam, the Philippines. One of the issues is that those populations have different kind of, there's so many challenges in terms of providing education, support, healthcare access to those communities. And sorry, I haven't talked about the EC Australia at all. This is a couple of the products. What we were trying to do with the hepatitis C program was to increase access for people who inject drugs, particularly to access the healthcare services and to be cured of hepatitis C. This slide is one that we actually kind of did a separate project, particularly targeting Indigenous communities. Again, this was done in partnership with a whole range of Indigenous health organisations around the country and with people who inject drugs around the country. The Hep B stuff, I'll come back to that, is that what we're trying to do with Hep B is to increase the number of people who, with hepatitis B, to access healthcare services for their infection. Hepatitis B is a silent infection. It's very easy to ignore, and treatment is not necessarily available for everyone. There are certain kind of clinical decisions that need to be made before people access treatment, but everyone with hepatitis B is recommended to be monitored. Now, that for me is a really big ask. For the other issue is that hepatitis B is highly stigmatized in countries such as China. So for in China, people with hepatitis B were not allowed to do government jobs. Their access to universities was restricted. Their access to kind of some workplaces were restricted. People were tested for hepatitis B by workplaces and in educational settings. So I did a needs assessment a few years ago in China of people with hepatitis B, and then people with hepatitis B were talking about being diagnosed in schools, in primary schools. They were talked about, one young woman talked about the fact that the names of people, that they did a health check, and that the names of people who were diagnosed with hepatitis B were put on the blackboard in front of the class. So in terms of responding to a health condition, that makes it fundamentally challenging, because it's not necessarily just a biomedical issue, it's actually a social, and for many people in employment, you know, it has huge social implications. Now, for people with hepatitis B who are born in China and who live in Australia, those ideas are still in the back of their heads. They don't necessarily trust the health system. They don't know that, you know, anonymity and confidentiality is a really important part of kind of health service access. Now, and that there's also kind of different health, traditional health beliefs as well. So they need to be accounted for as well. So in terms of one of the projects that I'm doing at the moment, we're trying to engage people with hepatitis B with the health system. We are trying to find, from their perspective, within their cultural traditions, within their language and their social norms, about how it is that they understand hepatitis B. within biomedicine, it's an infectious disease that affects the liver. Fine. But that's not necessarily representing the lived experience of hepatitis B. And the lived experience of hepatitis B changes within different communities as well. So for people in China, there's a huge, kind of social implications for being infected with hepatitis B, while in Burma, many of the Christian churches within that kind of a lot of support for people with hepatitis B, particularly amongst the Karen population in several kind of communities around Australia, is provided by Christian churches. And so there is absolutely no stigma related to hepatitis B amongst that population. So it's fundamentally different, and we need to ensure that those differences are addressed in terms of developing kind of good awareness, education, health and reducing health service barriers. And the project that I've got up on the screen at the moment is one of those that we're attempting to do, where we're using semi-structured interviews to kind of get the real individual experience of hepatitis B and to kind of talk through and find out from people from those communities about their individual experience, to look at how that fits in within a social issue and within a community issue. So if there is stigma, what are the kind of enablers to accessing kind of health services? What are the kind of challenges in health service access? And that can include migration, settlement, employment, housing. There are a whole range of kind of non-medical kind of issues that need to be addressed. And then do a series of co-design workshops and public health forums. One of the things for me is that our national policies around hepatitis B are generally kind of biomedically based, and that they don't look at human rights issues. They don't look at kind of settlement issues. And that was one of the issues that came up with COVID, is that the different culturally diverse communities, we're not kind of listening to the, to the general COVID kind of, Dr. Angela, that they weren't kind of, the mainstream kind of community messaging about COVID wasn't reaching the people from culturally diverse communities. And they were kind of, and you could see that happening.
Jack, just so we've got plenty of time for questions, I might just get you to wrap up in a couple of minutes.
No problem. And so we need to ensure that our health policies actually incorporate our whole community. 1/3 of the population is born overseas. Our health policies are made for kind of people born in Australia. We need to kind of broaden that. So this is the kind of work that I'm trying to do. And it is based on my lived experience. It all comes back for me around the fact that, I had hepatitis C. I was an injecting drug user. I was stigmatized to a certain degree by health services. I know what it feels like to be on the outer. So this is kind of, I love this stuff. Fantastic. So I'll leave it at that.
Jack, thank you so much. I might get you to just take your slides down and then we'll take some questions. Just such an inspiring story. I can imagine sitting on those very high level committees as someone, relatively young with a significant health condition, and well done. And I love the story around how you and the other consumers supported each other, which we know is so important. We've got a couple of questions that have come through the chat, and then I'll open it up for others as well. Just a question around, what are your reflections on the enablers to accessing health services when there is a significant stigma attached to a health condition?
And I was kind of, my first reaction to that is around visibility, to know that you're safe. And it's kind of, and I've never been a big fan of posters or anything like that, but when you are recognised, there was this, I saw a bus in Melbourne a couple of days ago, and it had the Pride kind of flag, the Pride kind of rainbow flag on it, saying "You are loved." And it was like, oh, geez, I'm 64 years old. You know, I don't need this shit, but I felt really warm. I felt like really accepted. I felt loved by a bus company. But it was that stuff about being recognised and about kind of permission. I suppose one of the stuff for me is also about permission, that I'm able to feel safe. To feel safe, to talk about what it is that I need to talk about, that it's not going to be judged, and that you're going to be accepted for,
Jack, also a question from in the chat around unpacking the stigma associated with hepatitis B. Do you think that the question is around, is that related to people's concerns about the possibility of catching the disease from the person who has the condition?
Sorry, what was the last bit? Is that
some of the stigma attached to hepatitis B, do you think that's associated with the possibility that people are concerned about catching it from that person?
Yeah. It's absolutely about a lack of information and awareness and education about hepatitis B, and it's almost and it's kind of really, you know, I find Hep B kind of really sad at some points, because you'll get so often I have heard people with hepatitis B talking about the fact that they know how it's transmitted, and yet they will microwave their plates and they will microwave their chopsticks because they're scared of transmitting. So there's a level of kind of like really kind of clear information about it, and then there's an emotional kind of like, oh, I'm really scared still. You know, so there's a cognitive dissonance between, you know, kind of around the facts and the reality. And that they are kind of scared. And even, you know, within families around kind of vaccination, you know, vaccination stops infection. There is no need to be scared of Hep B if people are immunised, and yet there's still a fear around it.
Yeah, and I think Pete's acknowledged that there are learnings with the hepatitis B and hepatitis C community that also apply with, you know, other conditions, health conditions, mental health conditions with culturally and linguistically diverse communities. Yeah.
And some of that for me is around the silence around it, you know, that we don't necessarily have the words to articulate how it is, you know, we don't have the words necessarily to talk about it. And that within particularly CAL communities, there is so much pressure on them to start off with. You know, if you're developing mental health, it's kind of like, yeah, of course. Why wouldn't you? It's hard.
Jack, thank you for a really inspiring presentation. Terrific to hear from you. Carol Hodgson's just joined us Carol joined Monash Partners earlier in the year as the Executive Director. Carol, I might invite you when we get through our next presentation to introduce yourself to the group, if that's okay.
Terrific.
Thanks so much. Jack, thank you. Our next speaker this morning is Julie Norman. Julie is the co-founder of 65 Kilometres for Cystic Fibrosis, a group of passionate parents of young people with CF that came together quite a long time ago now, Julie, to raise money to support research in CF that was important to the community. They were dismayed by the lack of funding for cystic fibrosis at the time, and Monash Partners team has had the great privilege of working with Julie and her team over many years now. So Julie, over to you to tell your story
my
about
story.
and
Thanks,
welcome.
Angela.
Lovely to
And I
have
need
you.
to say it's been an absolute pleasure working with Angela and the team from Monash Partners for many years now. So, so thank you for the opportunity as well to speak today. I'm joining you from the Wurundjeri land today. So before I start off, I'll just go into a bit of my background. So I was always in banking and technology. That's been my background until I had a child born with cystic fibrosis, which sort of throws a bit of a spanner on life. So through the years, I should say after the first 6 years, and you feel you can sort of emerge and start talking about cystic fibrosis without breaking down, I started joining a number of boards and different government committees to try and shift how we actually manage these chronic conditions. Because when you've got a child in the public health system, and the public health system is the only system that will deal with cystic fibrosis. It is quite daunting trying to keep on top of everything. At the moment, I'm still a consumer advisor on with Monash Health, but I'm sort of sticking to where I can combine technology and consumer activity. So I'm more focusing on clinical governance for their systems, AI, data governance, sort of trying to focus down that way while still closely involved with the CF community. So I'll just share my screen. And apologies, I've got a croaky throat as well today, so I might need some water breaks as we go through. Seems to be the time of the year for croaky throats at the moment. Just let me share that again. So I just thought I'd explain, and my screen has gone to the wrong screen, hasn't it? You can't see the right slide. Every now and again, my screen in the office decides to project the chosen image on another screen.
No
which it is
problem,
doing
Julie. We
today.
can see it, we just can't see full slide.
Okay, I'm going to try it again. See
No
if I
problem.
can drag that screen across. I've just upgraded my operating system and I'm finding all the nice little glitches you find. So I think we might just have to stick with this one for now, so apologies. So I might just explain what cystic fibrosis is first, because I'm sure it's quite new to many of you. So unlike Jack's talk, where it's a community-acquired more condition, cystic fibrosis is an absolute genetic condition. So to actually get cystic fibrosis, you have to have both of your parents have to be a carrier of the gene, and then you've got a 25% chance really of obtaining cystic fibrosis. So it's a chronic complex condition that mostly affects respiratory and digestive system. So at the time, Olivia is now, my daughter with cystic fibrosis is actually now 21, but at the time she was diagnosed at 6 weeks of age. So cystic fibrosis is one of the heel pricks that they do on all babies born in Victoria. So at the time she was diagnosed, I think she would have been lucky to have made the late 20s. So we are thankful medicine sort of improved. So as I said, it is an inherited genetic condition, but it's really complex. There's over 1,200 mutations through about 5 different classes. So it's really going to benefit from really targeted, personalised medicine. There's not one approach really fits all genetic conditions. At the moment in Australia, there's about 2,500 Australians affected. It is mostly a Caucasian condition, so it did come out of Northern Europe. It's what people believe now, out of more the Scandinavian countries. Although we are finding now with different healthcare in India that there are more Indians being diagnosed, people from the Indian continent being diagnosed with cystic fibrosis. At the moment, there is no cure, but medication approved over the last few years has drastically changed the trajectory and the outcome. So we're very pleased for that. So I thought I'd just explain a bit more about who we are. So this is us after a very poor photo after a very long day of running a long event. So we're all parents of cystic fibrosis. And I think I was lucky enough, probably in about 2011, 2012, through one of the boards I was on, to meet a passionate CF clinician who was also a researcher, who was also actually part of the team that discovered the CF genome back in the UK in, I think it was the 80s, the 90s. So he'd had a very close tie with CF. And he's absolutely convinced me that the only way we're going to change the trajectory for this condition is with research, because there was very little research being done in Australia. So I found a group of similar mums, and we all decided to try and raise money for cystic fibrosis research, but probably go one step further than that and actually have a sustainable revenue stream where we can actually try and grow researchers over the long term, not just the short term. So we needed a few things in place to do that. And absolutely, we wanted to focus on research that makes a difference. So I think at times, we've all been advised or seen different research happening, which was totally impractical to actually implement. So we really wanted to make sure we focused on research that, if it did get through, it was absolutely tangible. You could actually implement those research projects. So I just thought I'd go about how we went about this. So we were all in professional jobs, but none of us are event managers. So I'm in IT, and Susan and Kathy are both in universities and APRA. So we're all in professional jobs. but we didn't have any idea how to raise a lot of money. So we decided on a 65-kilometre walking event, and mostly we picked that distance because our motto has always been living with CF is no walk in the park, and anyone who's tried to walk 65 Ks will know it's certainly a challenge. So we have an event in Royal Park, Princes Park, Carlton every year. So it's a 10K, just over a 10K circuit, and we have 6 laps of that circuit. So being 65K, the event starts about 3 o'clock in the morning, goes through till about 5 o'clock at night. We are all absolutely wrecked by the end of it. And more recently, we have started introducing shorter distances of any sort of variant of the 10K circuit. So we started, our first event was in 2013, so we're going back quite a lot now. We've currently raised 1.2 million, that's net, for research. So we've been quite successful. We managed to keep going through COVID, which was a bit of a miracle, and had some good years through COVID with virtual events. I think one of the differences with us is the way we treat our donors. So I think we've all at times donated money literally through an envelope or a donate here, but you never hear what happens with that money. So we absolutely have all of our research detailed on our website with progress update reports. So our community absolutely knows where the money's been spent. We're also really stingy with money, so we run the event as cheaply as we can while doing an absolute good event. So we have a lot of people volunteering at our event and volunteering in kind product and service as well. So our next dilemma was, once we had some money, how do we find a research partner? And for us, it was absolutely paramount that we had a research partner who would listen to us, who would work with us, who would actually take input from the community to prioritise research projects. And we also needed, of course, a really strong brand, because we needed someone who's going to attract the best researchers across the country, and a really strong culture of consumer engagement. So we were absolutely, fell in love with Angela when we first met Angela, because we could see the whole Monash Partners had that whole ethos of working with communities. So we do use a lot of different, I guess, techniques now at how we actually do research. So there's a body in the UK called the Lund Institute that does a whole lot of research on different conditions and try and come up with top priorities. So we always set our goals each year of what type of research we want to achieve, but we do reference what's happening internationally, because of course we don't want to start a research project knowing that somewhere else in the world that same research project is probably going ahead with a larger budget than us. So we try and find unique research projects, and especially those that, and a combination of desktop or long-term scientific changes, as well as clinical improvements which can be implemented on a quicker time frame. And this is a very old slide now, but it just sort of goes through what living with CF is like. So as you get older with cystic fibrosis, the burden of care just becomes really significant. So these are just a whole lot of different, I guess, places we need to visit, clinicians we need to visit, tests we need to have done all the time, lots of exercise all the time, lots of medication all the time, and just lots of checking, just lots of absolute checking that you're not deteriorating. So we are lucky in Australia to have a good health system, but this is actually a whole of life condition. So it's absolutely important for us that we try and slow that trajectory down. So I've briefly touched on our model already, but it's really, for us, it was really important to come up again with our themes for research. So we have our money, we come up with our themes of what we believe is most important for the community. We also absolutely follow a proper scientific process. So all of our, we do go out for grants. All of our grants are peer reviewed by relevant professionals to make sure the project is technically sound and can be implemented. And then we have a really good process with Angela and the team to actually prioritise and approve the grants. So I guess we're always making sure it's technically sound, the project, but as well as being relevant for the community. So I just wanted to quickly conclude. I think it's really important, if you do have a condition and you do feel it's just not actually progressing well, there's always an option to try and raise money for research. So I think it's certainly a model that I've talked to Angela about how it can be extended into other conditions. I just think it puts a whole new focus for that community when you've got that community-led money that's raised with a very low cost base, and actually targeted towards the research that the community wants, and the community is informed of the outcomes and informed of the decisions. It's a model that's actually working extremely well. And also embracing continuous improvement, I should say. I think, Angela, we've tweaked our process a number of times over the years, which has always led to a better result. So again, we always have a recap every year on what we can actually do better. And I think that really concludes my presentation. Apologies that you were not able to see it in full view. But I think I'll just stop there, Angela.
Julie, thank you so much. Really inspiring, and it's been amazing to work with you and the team over a number of years, and thanks so much. We've got some time for questions, everybody. One of the questions, Julie, in the chat is around, there was one earlier actually. Just one second. Can cystic fibrosis be identified during pregnancy?
It can now, absolutely.
Days?
It does need one of the invasive. You can test if you're a carrier. So I guess the quickest way is for parents to test if they're a carrier or not. If you're not a carrier, you're not going to get CF, and that's just a cheek sort of swab genetic test. But if you are both carriers, then it's there are ways you can test if a child is going to have CF. Yeah.
Thanks, Julie. That's the benefit of improved
Yes.
scientific discovery, isn't it? And another question around the most important research to benefit the cystic fibrosis community in Australia. There have been a number of amazing breakthroughs recently. Which is there one that particularly comes to mind for you?
Oh, look, I think the biggest hit for the community is really not one that we could fund, but the introduction. I'll go into one we can fund and one not. There's been a lot of development across the states. There is a new drug called Trikafta, which if you have a specific genetic condition, it's actually making significant changes to quality of life for people with CF. But there's about 10% of the population who can't take any of these medications, and they're more genetic modifying medications. Very expensive, so we're very lucky that Australia is funding those medications, but they are changing people's CF. I think some of our one of our best projects, and Angela can probably explain this better than me with her medical background, is really around what we've been doing with one of our clinicians, Paul King, who we gave a small amount of funding money, and he is probably going to fundamentally change some of the whole drug delivery and drugs available for people with CF to actually limit inflammation in the lungs. And I think that is a good example of somewhere where we gave a small amount of seed funding. He came back for more seed funding, and I'm sure he'll come back again for more, where we've actually totally translated from desktop research into a real life scenario.
Absolutely, Julie. It's a terrific example of clinician-led research in the discovery area that will translate and I think really improve outcomes. And that seed investment has enabled him to do some initial piece of work and then leverage that for larger funds and more impactful work. It's a terrific example.
Exactly. There are actually CF mice too, believe it or not. The scientists are breeding CF mice to test all these medications on. Yeah.
Julie, thank you so much for your presentation and for making the time to chat with me.
My pleasure, Angela.
It's terrific to have you. I'm going to invite Carol to introduce herself. Carol Hodgson joined Monash Partners earlier in the year as our new Executive Director, and she's particularly passionate about consumer and community involvement. Carol, over to you.
Well, thanks, Angela, and hello, everybody. It's so lovely to see you all. I'm sorry it's not face-to-face, but hopefully we'll have a chance to do that at some stage later in the year. As Angela said, I had the honour of taking over as Executive Director of Monash Partners in January this year, and we've had a really busy year refreshing our strategic plan and making sure that we set really key priorities for our partners and our community for the next 5 years. So the launch of that new strategic plan is on November the 14th, and I hope you've all received communications about that. You're very welcome to join us. My background is that I'm an ICU clinician. So Julie, I really resonated with what you were saying about CF. My entire career, I've been a respiratory specialist and have treated many CF patients in ICU. I'm actually a physiotherapist by background, so I've been an ICU physiotherapist for nearly 30 years. And CF is certainly something that I've seen the worst of in ICU. And, I think Paul's work around reducing lung inflammation is so critical to make sure that patients stay out of ICU. And certainly, if they have an acute exacerbation of their cystic fibrosis, that it minimises the damage done to the lungs. So I just really loved listening to your presentation and the amazing work that you've done. As Angela said, I'm really passionate about partnering very genuinely with our consumers and community. I just think that it enables our research to be the most impactful it possibly can be. And I genuinely am looking forward to getting to know all of you and hearing your own stories and learning from you, and making sure that Monash Partners stays very on track with making sure that we serve the community that we are entrusted with. So thanks, Angela.
Thanks, Carol. I'm now going to invite Ashley Eng to speak to you briefly. Ashley's a research fellow at the Monash Centre for Health Research and Implementation, a part of the Monash Partners Consumer and Community Involvement team. And we've been working together for an MRFF funded project around a really innovative digital online platform. So Ashley, thanks so much for joining us, and over to you to provide everyone an update around this exciting piece of work.
Yeah, no, thanks, Angela. Thanks for having me. And it's always really exciting to share this update because it's a project that I'm quite passionate about. It just happens to all the stars aligned in my life to take on this project. So that's great. Just before I kick off, I'll do a bit of introduction to myself. So I am a diabetes advocate as well as a diabetes researcher. And over time, I didn't realize that consumer and community involvement was becoming this huge emerging thing. And so this has been quite a journey for me as well to learn more about the research that underpins consumer and community involvement and to play a small role in trying to help that adoption throughout Australia in health and medical research and in hospitals as well. So it's been really fun. It's been really busy. I'm just trying to share my screen before and try and do this. Really not as smooth as I thought I would be, but we'll get there one day. Great. Can you see the whole slide? So there we go. Got that? All good? Great. So today I'm going to be giving you a bit of an update around the Health Research Hub, which is part of the broader Medical Research Future Fund consumer-led project that I'm managing. So it's called the Consumer and Community Involvement Implementation Research for Impact, or C-SIRI for short. And if you have an iPhone, we learned this really quickly. If you say C-SIRI around people with iPhones, it just activates Siri. So we've all basically had to deactivate our series of iPhones, which has also been quite a learning. The broad overall aim for the project is really to generate the research and the evidence base underpinning consumer and community involvement, because we know that some researchers really want to see that evidence base before going deep down into embedding that into their own research. They want to say, well, we want to see proof that it works. We want to see that it's effective. Otherwise, it's just going to be a waste of our time. So here we are generating that knowledge and evidence base, as well as practical solutions to embed consumer and community involvement within research and clinical care as well. So in hospital settings, so quality improvement projects as well, and really just to improve overall the relevance, translation, and health impact. We all know the value and the importance of involving consumers in our research, in clinical care, in healthcare improvements. So now it's just trying to spread that word a little bit broader. So I know I'm preaching to the converted here, but everyone plays a really important role. And so what we did was we did a lot of interviews. We did a national survey, and we had some co-design workshops, as well as we're still testing the website at the moment. So I'll break down those little bits and pieces. So what we did, and this is specifically to developing the hub, we also have another section that's looking at breaking down what a consumer community involvement network would look like as well. So there are two kind of mainstreams of that project. So to build the hub, we did a national survey. We reached out to basically everyone that we could, and we got 270 responses from the whole of Australia. Consumers, we got 138 responses, which is amazing. And then healthcare improvement staff and clinicians, we got 42 participants, and then researchers, we got 90. Then I also did semi-structured interviews, so interviewing the research funding bodies as well, so national funding bodies like the NHMRC, the Medical Research Future Fund, consumer organisations that provided funding as well, so Diabetes Australia, Arthritis Australia. We interviewed consumers too, so some of you here have taken part, so thank you very much. We also interviewed healthcare improvement staff and clinicians and researchers. So you can see we really wanted to get an idea from the different stakeholders of their experience and their thoughts and around consumer and community involvement, what the barriers were, what the challenges were, how we could really support that adoption. And then from there, we used all of that information to put together a bit of a, I guess, a prototype or like a bit of a draft of what that hub would look like based on building upon previous work as well that has been done by the ARA Centres, so the Australian Health Research Alliance, and the different pieces of work that's been done throughout the years. And by understanding the different knowledge, attitudes, beliefs, the barriers and enablers to consumer and community involvement, we were able to shape the key messages and the language that we will put onto the hub, as well as the type of resources that we need, and trying to figure out how people would navigate that site, what they would use it for, and the best way of presenting that in a digital hub. So once we've got that, we started to do some co-design workshops. And I'll show you. So this is how it all started. So we basically whiteboarded everything. Where is it? Everything is going to go. We drafted up some basic pages to see what that could potentially look like. We took it out. We had lots of workshops. We had personas as well. So people had to think outside beyond themselves and their own circumstance to think about what someone else would do when they were looking for consumer and community involvement information. We drafted up pages, we printed them out, we got people to put sticky notes on things that would work, things they didn't like, things to improve, language, colours, everything. And now we're at a very nice digital prototype, so you can actually click things, you can see where it's at the moment. And so we are currently testing this prototype with people and just trying to understand their journey, where they would click, how they would understand things. Do these things work visually? Do we need to have more pictures there? Are the pictures relevant? What are the texts like as well? And you can see we've had another iteration of that case, that persona as well. We've brought that back in terms of, okay, so if you were to think beyond you, what would that look like when you're navigating this hub? And so what is next for the Health Research Hub? And I should also say that within the hub, you can see there are 3 different sections. There are information that's pitched specifically for consumers, for health and medical researchers, as well as for those working in quality improvement in healthcare. Within the hub, we'll have resources, information around how to connect with people, but also what we're most excited about is the discussion forums where there'll be a space where you can connect with people and find out what people are doing, but also to put together things that you're interested in. So for example, for consumers, you can share, I'm really interested in, say, a project around CF and specifically how different foods might affect CF and sort of down the track what that would happen, as time goes on. So they could say, I'm really interested in this. Are there any researchers working on it? I'll be really keen to collaborate. And on the other hand, we'll also have another forum for researchers saying, we're looking for consumers to help us shape a project around diabetes care in aged care facilities, for example. We're looking for people who have that connection or who are interested in that. Could you reach out to us and we can talk a little bit further? So 2 really key avenues of connecting for research from both a consumer perspective and a researcher and clinician perspective as well. So very excited to share some of that with you. At the moment, we're just fine-tuning a lot of the text and things like that. And the really next steps are to launch it once we've done all the feedback and to do an evaluation of it. So we'll send the link out broadly to everyone. There'll be a little survey that you can fill out to put your thoughts and your feedback in that. So this is where everyone comes into play. So if you could, when that link comes live, please, encourage your connections and your networks to fill that out and to evaluate that as well, because we need as much feedback as we can to make sure that this suits, a broad audience and that it is useful and that people will use it as well. And we also want to translate the findings from all the interviews and the surveys that we've done into very practical outputs across several levels of the system. So, for example, at the large government funding level, that influences research. How can they help support consumer community involvement, all the way down to hospitals, to research institutes, to researchers themselves, and at the individual level as well. What training resources do we need? What other resources do we actually need to just help drive that moving forward? So that's a bit of an update on where we're at. Happy to take any questions.
Thanks, Ash. That's terrific. Great to get an update, and amazing work, and watching it unfold. A question from Margaret, a really good question. If someone was to do a Google search for the Health Research Hub, how easy would it be for them to find it?
Yes, so that will rely on the back end, and we will do what we can in the back end. So it's called search engine optimization, and we've got people who are skilled in doing that. So what they would do is plug in all the different search terms that people would potentially use to make sure that when they search consumer community involvement, it will come up straight at the very top of the Google search as well. But also having a dissemination plan, so making sure that we're targeting consumer organizations, health and medical research institutes, community organizations as well, so we get outreach as far as we can. And just to answer Tessa's question in the chat as well, is this will be a website for now, but we have hopes down the track of making it into an app too.
Fantastic. Alison's got her hand up. Over to you, Alison.
Thanks, Angela. Ashley, that looks great. Sorry, I'll be really quick. Is there going to be sort of opportunities for people who don't speak English perhaps as a first language, or for culturally diverse communities to be able to engage with this website as well?
Yes, so definitely down the track, we are hoping to have different iterations where we can have translations into different languages. For now, we're just trying to, with the limited funding and the time that we have, we're just putting something out there, and then from that, as a prototype, as a pilot, we would then get more funding to then translate that and make sure that it's culturally appropriate for different settings and for communities as well, and having certain resources in different languages and things like that incorporated in there as well. Yeah. And Harpreet, I saw your question around integrating into Aging Well programs or disseminate through such programs. We can certainly work on that as well. And this will be where we will call upon your help, because you guys will have that network to help spread that word. And so we would appreciate your networks and your passion in sharing this with other people. So that's why your feedback is really important, to make sure that it is relevant to them as well. And you've got your hand up. Do you want to extend?
Yeah, thank you, Ashley, for answering that. The Officer Gurdwara has started an Aging Well program. The first Aging Well program for multicultural communities is being organized on 26th of October, Saturday, in a few days from now. But in future, I mean, we are happy to share more details with you, so that if you wanted to come, or if your colleagues wanted to come and talk about your work with the multicultural communities, that can be facilitated. But in the meantime, if you have any resources that you want us to disseminate or give it to the communities who are attending this program on 26th October, feel free to let me know, and I'm happy to, place them for circulation. Thank you.
Fantastic. Thank you. At the moment, we're just really we've got a very tight timeline to get this turned around, to make sure that it gets launched with enough time so people can provide feedback. So we haven't got things to, I guess, share for now, but definitely down the track. Don't worry, I'll be hassling all of you, so keep an eye on your inboxes.
Thanks so much, and thanks everyone. I'd just like to acknowledge our presenters today, and thank you all for your support of our work throughout the year, and also for attending today. Joe has just put a very brief survey in the chat. We'd welcome your ideas about topics for other seminars. And we will be looking at a social event before the end of the year, so watch out for some communication from us about that. Otherwise, thanks so much for your time, and have a wonderful day, everyone. We'll be in touch.
Thanks, everyone.
Thanks
Great.
all.
Thank
Bye.
you.
Thank
Bye.
you.
Thanks,
Bye.
everybody.
Thanks, everyone.